Hi, everybody. Dr. Brian Hooten here with your Hope Dealer podcast, recently rated #1 best new healthcare podcast on the planet and, in fact, the entire universe. Today we're inundated with so much information about our health, especially when it comes to pain, back pain, and neck pain. So in this episode, we're going to talk about those two things specifically. And I've had some back pain just from being sore over, adjusting a couple hundred people in a day. But I've never had to deal with debilitating back pain or neck pain like so many of you have had. And depending on the research you're reading, it's up to 1 in 2 people have these episodes of just debilitating chronic neck and back pain. So I know if you're listening to this podcast, you either yourself are dealing with or have dealt with, or you know somebody that is dealing with it. And unfortunately, because of all this crazy information that's just jammed down our throats through all kinds of media, is take a drug. Let's go over the counter. Let's try this mild NSAID, non-steroidal anti-inflammatory drug. If that doesn't work, then we'll go to the heavier stuff. And of course, none of that fixes you. It cannot fix you. It never will fix you. So you reach for something more powerful. And that little trail, that rabbit hole goes all the way up to fentanyl and those big time, highly addictive substances. And everybody knows somebody that's probably had a family member that got into fentanyl or something like that. God forbid you have, but it's so common nowadays. So we're talking about the entryway to stuff like that. If you want to avoid and prevent a future catastrophe in your life, you will tune in, because most of you will have or have had back and neck pain, and you've got to get to the bottom of this, or you just start this whole trail down to the disaster. And I want to help you stop that. Number one thing is you have to get your mindset right. An improper mindset or a poor mindset or a mindset that will make you worse is thinking you have to go to the doctor, thinking that you have to take something, thinking that you have to have surgery. None of that is true. Now, is there a time that might have to be the case? I'm not here to tell you yes or no. All I know is that you have a choice. You can either focus on the symptom and treat that, or you can come into an office like mine, like ours, and start building health in your body, whether that's neck pain or back pain or anything else. If you've watched our previous podcasts, I had a major childhood case of asthma. In fact, it had a weird name to it. It's the same principle. We wanted to get well, so when we wound up finding a special chiropractor, she helped me build health in my own body. And you got to take the same approach for neck pain and back pain. So I'm going to talk about 2 special patients in her office, Rachel and her dad, Tony. Now, Tony, he had neck pain for years, and he went through all the traditional treatments, where there's medications and talking to doctors, injections, and what have you. And because none of that fixed him, physical therapy doesn't fix the health of your joints, it kept getting worse and worse, and he wound up having a surgery. So this was way before we met. Well, a surgery is nothing more than another cover-up. If you don't stop the process that got you into that situation in the first place, it's going to continue. So the surgery in his case gave him some temporary relief, but eventually this pain started coming back because nobody had helped him stop the process and got his spine strong. Even with all the physical therapy, that's a totally different animal. If you're a physical therapist and you've been through that and you're hearing this, look, I'm not knocking you guys. If I tear up a knee, and I have to go have surgery on my knee, I can't fix it myself, I'm coming to a physical therapist to rehab my muscles. I'm not talking about muscular rehab. I'm talking about the essence of the spine, the disc material, all the little ligaments and tendons in there. That is my territory. And Tony had never gone to anybody like me. He'd gone to surgery, all the physical therapists, on this medication, and his pain was coming back after the surgery. Well, he got referred in by a friend, and I took his x-rays and I showed him exactly what was happening and why it would continue to happen. And I asked him, I said, Tony, you went to these orthopedic spine doctors, you went to this therapist, and you did all this stuff. Did anybody explain to you that this was going to continue unless you got your spine healthy? And he said, no. In fact, some of the language I've heard over the years is that when people have one spine surgery, the doctors will tell them this will give you 5 to 7 years before we have to have the next surgery. That blows my mind. So I took these x-rays with Tony. I told him this is what we have to do to get, because where he had the surgery, I can't do anything about that, but the rest of his spine, I can help him get that strong. So we laid him down on the table, and of course he was apprehensive. He had a surgery, And all the questions he's coming around, he said, is this going to be okay? Are you going to paralyze me? The whole thing. And I said, look, Tony, there's no danger here. My malpractice insurance is less than $2,000 a year. The last time I looked up an orthopedics malpractice insurance, it was like $200,000 a year. It's much more dangerous going to see them. In fact, it's more dangerous to take a Tylenol than it is to see me. So I started very gently, started working on him. If you've seen our videos on social media, you know there's a lot of this pulling, or what we call the life changer adjustment. I had to do that to him to stop some of this compression, and his pain started to go away, and his spine started to get stronger. Now, his spine was in pretty bad shape, so he's in here regularly. We see him 2 to 3 times a month, but it keeps this pressure off his spine. He doesn't hurt, and he's not facing another surgery. Well, once we helped him, he brought his sweet daughter in, Rachel, who was a volleyball player. And her back started hurting so bad that way before me, they took her to the doctor and they started the MRI procedure. You know, you went down that whole thing. Here's a herniated disc, Rachel. You got herniated disc, and you got something called stenosis. You shouldn't play volleyball ever again. So the doctors, unfortunately, they didn't know any better. They gave authority over their life to these doctors who put a stop to this volleyball. No more volleyball, Rachel. No more doing what you love to do, because otherwise your back's going to keep deteriorating. You know, they don't want to acknowledge, the doctors don't want to acknowledge there's somebody like me out there that can stop all this and help somebody get strong. Well, her dad started to get better, so he brought his sweet daughter in while she was going to school up at Oklahoma. Sorry, he went to Oklahoma. And they brought her in, started working on her. Now, she needed some of the same type of care that her dad needed, where I had to pull on her because her disc was getting squashed. Her spine, down at the base of her spine, the bones were just grinding down on this disc and squishing it, so it was bulging out and started to go into the spinal cord and the nerves. Yeah, that's going to hurt. So we decompressed her spine with a special kind of adjustment, and boom, that pain started to go away immediately. Now, I want to be real clear on something. Tony, the dad, who had all this spinal surgery, neck surgery, Rachel, who had this herniated disc and stenosis in her lower back, I did not cure them. I didn't fix their discs or their pain. They fixed themselves. And that is a very important understanding. I'm going to move the bones so God and the power that he put in you can go to work and fix you. It is exactly the same kind of healing power that you have when you cut your arm. Let's say that you had a paper cut on your arm. You don't have to think about it. Your brain, through your nervous system, organizes everything and fixes that cut. A few days later, it's scabbed over. A couple weeks later, it's gone. If it's a deep enough cut, obviously you get a scar, but you heal from that. That same exact healing power is coursing through your body 24/7, 366. It doesn't take a break. How cool is that? All the time, your body's fixing something. It's healing this, it's healing that. Well, I want mine healing at 100%. How about you? Well, number one starts with you taking authority and getting into a place like ours. Number two, you got to get your spine flowing. Your brain is in charge of all of it, no matter what anybody has ever told you. You go do a test, you do an MRI, and they say, here's your symptom, here's your herniated disc, this is what's causing your pain. If they don't start talking about the way your brain gets there, you need to run away from them and get to an office that focuses on getting your brain to your body where it can fix itself. Now, like I said earlier, if the damage is so far gone that you can't fix yourself, I'll help you with that. We'll help you. We'll show you what to do. But even in that case, right, I want my brain getting to my body as much as it possibly can. I want it fixing. I want that power that God put in there. I want it flowing to everything. And here we go with the garden analogy, right? Your body is this beautiful garden. It has all these plants in it, including your discs, all your muscles, your sciatic nerve going down your leg, your feet, your reproductive organs, your heart, your lungs, your liver, your kidneys. Everything is in your garden, completely controlled by this. So if you think about your garden needing all that water, so your brain would be the water supply through your water hose, you want that flowing at 100%. If you shut it off, your garden dies. If your hose gets kinked, well, now some of the water's not getting through. What's going to happen to your plants that way? Are they going to be 100%? No. Are you going to be able to fight off, damage to your spine? Are you going to be able to repair from herniated discs and stenosis? No, you will not at 100%. So that kink in the spine, we call that subluxation, and it quite literally destroys your garden by blocking the information from your brain getting there. It is a devastating, silent condition, and the only way to find it if you've got it is to actually get x-rays and have somebody like me qualified to measure and assess what's happening in your spine. I don't want any kinks in my spine. Now, I've got some. That may shock you. I'm sitting here. I had a big curve in my spine when I was younger, as a baby. I've still got some kink in there, but I have to take care of it. I still have subluxation in my spine. I have to take care of it. So I do exercises specific for my spine every single day. I get adjusted 2 or 3 days a week here by the wonderful doctors that are with us. When Hannah and Rachel, by the way, who we saved off her back surgery, she did by coming in here. She's going to chiropractic school right now, and she's going to be adjusting me. I can't wait for that because she's going to have all this fire coming through her adjustments. And for me, are you kidding me? I'm excited about that. If you're dealing with herniated discs and stenosis, if you're trying to avoid surgery, you've got to get into an office like ours who is qualified, to look at your spine and say, look, this is what we've got to do to get that joint, to get the integrity of the discs back into a stronger situation. If it's just left that way, things get weaker. Like even if you have a surgery, the area around the spine is going to get weaker. You know, we have a lady under care, 10 spine surgeries. She's had 10 spine surgeries. Now she listens to me. You know, she had 9 of those before we met. When she came to see me, I was like, and we tried everything, but she had waited too long again, but that was years ago. So now we've got it under control. The rest of her spine is not breaking down. She no longer deals with the pain. She doesn't take any medication. Try that on. Man, 9, 10 spine surgeries, you'd think she was in pain all the time. But because she's taking care of it properly, she's not living in pain, and she's doing great too. If you're trying to avoid a surgery, if you want to get your discs back in good shape, you got to come in and see us. And if you've had a surgery and you want to see if we can help, we're here. We're right in the heart of North Texas, Beltline and the Tollway. And I've got people driving in from as far as Austin, Texas, coming to see us. If you don't live here and you want to come in just for a couple of days and see if we can help, I can give you ownership. We can give you your x-rays, and we'll help you find somebody that's close to you. But listen, don't sit on it. Don't wait. You know, I talk to people all the time who have a little nagging pain they don't think about. You know, I worked on somebody the other day, and he had even forgotten that his spine was hurting a little bit in the middle. It just didn't bother him all the time, so he'd forgotten to tell me about it. And he just told me, he goes, Doc, after you adjusted me, that this little pain I've had for a while, it's just gone. I had forgotten about it. Well, those are the kind of things that sneak up on you and create a disaster in your garden. So don't wait. Some of the most dangerous words I ever hear from people are, I feel fine, I'm doing great. Then you turn around and they actually are taking some medication. They are in pain because they're covering up the symptom or just ignoring it. Don't do that. That's what leads you to disaster. So if you want 40, 50, 60 years old to be better than it is today, if you want to be 70 and 80, enjoying your grandkids and great-grandkids, which is what I want to do, you'll start taking care of your spine properly. We're easy to find. You can look us up at drhooten.com. We're on social media, Hooten Family Healing Center, right here in the middle of North Dallas. Call us up. We'll help you find someone. Remember, drugs are bad. God is great, and so are you.
Let's go.